Polycystic ovary syndrome, otherwise known as PCOS, a discussion of women's health. This syndrome is the most prevalent ovarian condition among the AFAB community, or individuals assigned female at birth. This condition affects 1 in 10, which accumulates to approximately 5.5 million individuals in the United States alone. This is enough people to fill an Eras Tour stadium 80 times. Despite its prevalence in the United States and the world at large, 70% of women go their entire lifetime without diagnosis. Moreover, this condition affects those aged 20 to 50, but it can start as early as an individual undergoes puberty. But ultimately, what is it? PCOS, as it states in the name, is a condition of the ovaries. Ovaries are the small egg-shaped glands at the end of the fallopian tubes and the infundibulum. These small tissue glands are responsible for the sex hormones of an individual, as well as for the production and pre-fertilization storage of eggs. So, what does this syndrome do? This syndrome actively influences the production of androgen, the male sex hormone, by massively increasing production rates. This influx of androgen creates hormonal issues with the individual and will also affect the other role of the ovary: eggs. As one releases an egg with the menstrual cycle, the egg passes through the infundibulum and into the fallopian tubes. However, due to hormonal influx, this passage is either partially or fully blocked for the egg. This results in either a painful and often late period or an absorption of the egg into the ovarian sac known as a cyst. This process ultimately leads to the symptomology of the condition. The main 3 symptoms of the condition and the diagnostic criteria are as follows: inflamed ovaries or ovarian cysts, increased levels of androgens, and irregular or missed periods. However, this syndrome can include a whole wide range of symptoms like hirsutism, acne, obesity, acanthasis migrans, skin tags, thinning, oily hair, infertility, and more. Additionally, it comes as a risk factor for several conditions like diabetes, cardiovascular disease, hypertension, endometrial hyperplasia, apnea, endometrial cancer, anxiety, and depression. And like most things that we see in the world, disease isn't equal. PCOS, like many illnesses, has different effects on different ethnic groups. For example, Hispanics may experience increased levels of HOMA, hirsutism, acne, FIA, insulin resistance, and systolic hypertension, whereas non-Hispanic Blacks may alternatively suffer from increased sebum, insulin resistance, systolic hypertension, cholesterol, cardiovascular disease, and infertility. Now, as a condition that has to do with AFAB individuals and the female reproductive system as a whole, pregnancy and birth is a relevant discussion to the condition's effects and impact. The condition poses both pre- and postnatal risk to the mother and the fetus for things like miscarriage, gestational diabetes, preeclampsia, pregnancy-induced hypertension, preterm birth, emergent cesarean births, NICU time, post-labor death, and macrosomia. However, treatment for this syndrome does exist. Currently, as a syndrome and a chronic condition, PCOS has no cure, but can be treated in a variety of ways. Doctors may prescribe from one or many spheres of treatment, including lifestyle changes like a hypercaloric diet and aerobic exercise, or medications like birth control to restore hormonal balance and absolve period conflicts. Doctors can also use alternative medications like diabetes or metabolic medications, as well as hormone blockers to aid in the treatment of symptoms. As the biomedical engineering and OBGYN fields look to treat reproductive health and conditions like PCOS, we expect to see and have seen tremendous growth. One of these areas of growth is MVT-602, a new drug that's being developed to treat PCOS. According to various animal models and studies at universities, PCOS's core irregularity comes from the endocrine system of the brain rather than directly from the ovaries. That's why MVT-602 is using new technology to work on accomplishing 2 main tasks: A, crossing the blood-brain barrier effectively, and B, working to neutralize and reprogram the kisspeptin and neurokinin B cycles of the hormones. As biomedical engineers, OBGYNs, and practitioners around the world work to develop and treat PCOS and conditions like it, it's important to remember the struggles and design constraints that they must work around. These include, but are not limited to, maintaining the fertility of the patient with treatment, effectively treating the widespread list of symptoms as opposed to specific targeting, and working to cross the blood-brain barrier for a full effect of the endocrinological system. Thank you for watching.